If you are listed for a unicompartmental knee replacement, you may be a suitable candidate to have it done as a day case procedure. So what does it involve? In this video, we will explain to you the whole process of our day case uni knee pathway. Hopefully by the end of the video, you will feel well prepared, which will accelerate your recovery process.
Day case surgery means you're discharged on the same day as your surgical procedure. Day case surgery has been shown to have significant benefits for patients, including quicker recovery and higher patient satisfaction. Most patients prefer to recover in the comfort of their own home, and the aim of day case pathway is to facilitate day case discharge in a safe and effective manner. The day case pathway is developed by a team of healthcare professionals, including orthopedic surgeons, anaesthetists, occupational therapists, physiotherapists, theatre staff and ward nursing staff. We've also used patient feedback and previous patient experiences to improve this pathway. The key components of this pathway include pre-op assessment clinic, preparation at home prior to your surgery and coming in for your surgery. This will be explained in detail later in the video.
Unicompartmental knee replacement is designed to replace only the worn out part of the knee, usually the inside or the medial side of the knee. A unicompartmental knee replacement is performed without removing or cutting any of the ligaments in the knee. There is also minimum damage to the soft tissue. Not all patients are suitable for a unicompartmental knee replacement, and the other alternative is a total knee replacement. You will be offered a unicompartmental knee replacement if your surgeon thinks you are a suitable candidate. However, the final decision will only be made when your surgeon opens up the knee and looks inside. If there is too much damage on the other parts of the knee, your surgeon will perform a total knee replacement instead. A unicompartmental knee replacement is made of two metal components and a plastic liner called an insert. The metal components are fixed onto the end of the thigh bone, the femur, and the top of the shin bone, the tibia, using cement. The plastic liner is then clicked into place on the metal component of the shin bone.
Unicompartmental knee replacement is a very successful operation, with 96% of patients satisfied with their operation. That's a lot higher than in total knee replacement, where approximately 82% are satisfied. It's a smaller operation compared to a total knee replacement. It requires minimal soft tissue dissection and all the ligaments of the knee are kept in place. In addition, if you look at how much bone is removed in a unicompartmental knee replacement, it's less than 20% of the bone that's removed in a total knee replacement. So that translates itself into less pain immediately after the operation, a quicker recovery, and a knee that in general feels more like a normal knee. When compared to a total knee replacement, in general, patients are telling me that they often can't tell a year down the line that they've got a knee replacement in place, whereas with a total knee replacement, it never feels like a normal knee. We have something called the National Joint Registry, where we have all the knee and hip replacements that are done nationwide put in. And we know from the National Joint Replacement that with the best performing partial knee replacement, which is the one that we use, the 10-year survival rate is 94%. That's compared to 96% with a total knee. What does that mean? Well, it means that if you look at 100 knees 10 years down the line, 94 are still in. And we have some evidence to suggest that even 15 years down the line, you'll be well over 90%. So those figures are very, very similar to those of a total knee replacement. And in addition, we also know that serious complications such as an infection or blood clots or stiffness following a unicompartmental knee replacement are 3 times lower than those following a total knee replacement.
You will also be asked to attend the pre-op assessment clinic several weeks before your operation date. The pre-op nurse will go through a series of health checks with you, including your medical history, allergies, medications and social support. Blood tests and/or a heart tracing, ECG, may be performed. The pre-op nurse will also go through with you what you need to do to prepare for your operation. You will be asked not to have any breakfast on the morning of surgery, but you are allowed to have a drink such as coffee or tea with milk prior to coming into the hospital for your operation. If you take any regular medications, you will also be given specific instructions to stop certain medications such as blood thinners. You may also see the consultant in the pre-op assessment clinic to go through the operation in more detail and to sign a consent form.
The occupational therapist will collect the screening form that you have completed about how you normally manage at home. We will review the form, and if you have any concerns about managing after your surgery, We will contact you before you come into hospital for your surgery.
In preparation for your surgery, it's important that you maintain a healthy, high-fiber diet, as some of the pain relief medications given to you after the operation can cause constipation. You will also be asked to wash yourself using a special solution the day before the surgery to reduce the risk of infection. You'll be given a carbohydrate drink to take the night before surgery and early morning on the day of your surgery before 6 a.m. You should take your medications as usual unless you have been told to stop them by the pre-op assessment nurse. It is also advisable that you take the appropriate arrangements to help your recovery at home should you need them.
Please carefully consider how you will manage after your operation when you return home. You will likely feel more tired than normal and you will be using a walking aid. Please organise support for your shopping or arrange to complete it online. Stock up with food that is easy to prepare. Ensure that your home is accessible and you can safely mobilise with elbow crutches. The crutches will make it difficult to carry things at home from room to room, so please bear this in mind. Occasionally, patients will need to take equipment home from the ward to assist them on and off the toilet. Please discuss this with whoever is taking you home before you are admitted.
On the day of your operation, you should arrive on Ward 207 around 7 a.m. The nurses on the ward will do the admission paperwork and ensure you are well prepped for your surgery.
Lisa, hi, good morning. My name's Rachel Atkin. I'm a nursing associate with the team here and I'm part of the team that are looking after you today. How are you feeling?
All right.
You're good, are you? Welcome.
Yeah. Thank
You're
you.
having your knee done today, is that
Yes,
right?
that's right.
Wonderful. I'm just going to admit you
Okay.
and we'll do a little bit of paperwork and get some bits and pieces out of the way and then the rest of the team will come and see you. Is that okay with you?
Yeah, that's fine.
Lovely.
You will also be seen by either your surgeon or his or her assistant to confirm that you are happy to go ahead with your operation. Hi Lisa, my name is
Hello.
Jimmy. I'm Mr. Straw's fellow. Can I just confirm that you are having your knee replacement today?
Yeah.
Yeah, it's a partial knee on your right side, is that correct?
Yeah.
Okay. Are you still happy to go ahead with the operation?
Yeah.
Yeah? So what we're going to do is when we open your knee up, there's a very small chance that we may have to convert to a total knee, okay? That depends on the damage within the knee,
Right.
okay? He or she will also draw an arrow on the site of the operation as part of our routine protocol. The anaesthetist will also see you on the ward and discuss with you the options of anesthetic you will be having for your operation. This can either be a general anesthetic, where you are put to sleep, or a spinal anesthetic, when the lower half of your body is numbed up by putting some local anesthetic around your spine through a needle in your back. Often, you will also have additional local anesthetic put around the nerves to your knee to provide additional pain relief after the operation. This is called a nerve block.
So I'm from occupational therapy. I've just got a few questions that I need to go through with you. Is that
Yeah.
all right?
Yeah. That's fine.
So do you live on your own?
No.
Live with family?
My husband, yeah.
All right.
You will be seen by members of both the occupational therapy team and the physiotherapy team on the morning of your operation. The physiotherapy team will explain and demonstrate knee range of motion and strengthening exercises with you that you can start after your operation. All these exercises are detailed in the booklet you will have been provided. You will be measured up and provided with elbow crutches and shown the correct technique to use them safely for when you have had your operation. If you have steps or stairs, you will have the chance to practice these with your therapist, preparing you for when you return home. You will be asked where you would like to continue your post-operative therapy as an outpatient, and this will be arranged by the physiotherapy team for around 2 weeks after you return home. This is a good opportunity to ask the therapy team any questions you may have about your rehabilitation. The occupational therapist will meet you on the ward and confirm that you have organised yourself for a day case procedure and check that nothing has changed from your screening form. The theatre porter will come and collect you from the ward when it is time for your operation. The porter will take you from the ward to the theatre reception, where you'll be greeted by friendly and professional theatre staffs. As part of the routine protocol, your information will be checked again by the theatre staff before you are taken into the operating theatre.
What are you having done today?
I'm having a partial knee
On which side's that?
on the right.
Okay. So you've consented for a unicompartmental knee
Yes.
replacement.
You may have to wait in the theatre reception for a little while whilst the theatre is being cleaned and prepared for your operation.
In the anaesthetic room, you will be greeted by the anaesthetist, who you had met earlier, and an anaesthetic practitioner. Your information will be checked again as part of the World Health Organization guidelines, and a small cannula or drip inserted into the back of your hand so the anaesthetist can give you some medication and fluid for your operation. Depending on whether you're having a general anaesthetic or a spinal anaesthetic, this will be performed by the anaesthetist. The anaesthetist will also perform nerve blocks at this time. Once all the anaesthetics were completed, a cuff called a tourniquet will be applied around your thigh to provide a clear view for your operation. The team will also apply some props on the bed so your leg is in the appropriate position for the operation.
Once the positioning is completed, you will be taken into the operating theatre. The theatre team will perform another check before starting the operation.
Hi guys, we've got Alicia Jones, born on the 18th of the 10th, 83, 600583.
The operating theatre is usually a very relaxed environment. There may be some soft music playing in the background. During the operation, there will be a screen separating you from the operating field to keep everything clean. The anaesthetist or the anaesthetic practitioner will monitor you throughout the operation. You can bring your own headphones to listen to music during the operation, or talk to the anaesthetist to keep you relaxed. The operation typically takes around an hour. Once the operation is finished, a clean dressing will be applied, followed by a cold cuff, which will help with pain control and reduce swelling. From the operating theatre, you will be taken to the theatre recovery. You will usually only spend a short period of time in theatre recovery. You'll be taken back to the ward once the recovery nurse is happy with your observations, such as blood pressure and heart rate.
Hi Lisa, welcome back to the ward. I don't know if you remember, my name's Rachel. I'm part of the team that's looking after you today. How are you feeling? You've had your knee done now. That's great, isn't it? I'm going to take your mask off, my lovely. You don't need that whilst you're with us now. Okay, and I'll get rid of that in a moment. Lisa, I'm going to take your observations just to check everything's okay. We'll just run through a few things together.
Once you are back on the ward, you'll be given a drink and some food to help your recovery. The nurses will also get you up and walking straight away as part of the enhanced recovery process. This has been shown to accelerate recovery following joint replacements. You will also be given medications for pain or nausea as required.
A member of the occupational therapy team will practice with you to ensure that you are able to transfer on and off your bed, chair and toilet at home, and issue any additional equipment required for you to take home with you. Once you are mobilising safely with the use of crutches, it will be ensured that everything is in place for you to continue to recover safely at home.
All your medications for you to take home would have been prepared earlier by the ward team. The ward team will also give you instructions on keeping the dressings clean and dry, getting the wound checked and clips removed at around 2 weeks, and some follow-up instructions. You will also be given a contact number to ring if there's any problem. X-rays and bloods are not routinely required. However, if requested by the surgeon, X-ray can be performed on discharge prior to you leaving the hospital. Otherwise, X-ray will be performed when you attend for your follow-up clinic in about 6 weeks' time.
It is important to keep yourself hydrated and to maintain a healthy diet to aid your recovery. Elevation and icing of your knee will also help with the pain and reduce the swelling. Taking your pain relief medications regularly will control the pain better than waiting for the pain to come on before taking them. You will also receive a follow-up telephone call from the physiotherapy team to check on your recovery. Remember to do your exercises regularly to ensure your knee moves well and to reduce the risk of stiffness. Thank you for watching the video. If you have any questions, please contact the team.